In here to the chat on Newsday Amarillo and News Channel 10-2. I'm Jake Boson, filling in for David Lovejoy.
I am David Lovejoy's stunt double / understudy, Alan Robertson here.
And I'm known all over the world in some parts of South Carolina, Chuckalicious Chuck Williams.
And we're joined right now by one of our favorites. We got Dr. Parker joining us, sir. Good morning. How are you, Dr. Parker? Happy Friday.
I'm fantastic. Happy Friday, guys. Hope you're doing great.
Doing well. Go ahead.
Dr. Parker, tell me exactly, what is regenerative medicine? A brief description.
Well, you know, there's a real simple description is that we use natural biological tissues to help rebuild, regrow, and help the joint to actually repair, so that we don't have to do surgery and we don't have to continue to take drugs to try and overcome chronic joint problems. We actually help the body restore and rebuild like it naturally does. We just take it to another level.
I think there's a lot of, I don't want to call it misinformation, but misunderstanding out there about what regenerative medicine is, what it means, what it could lead to. Can you, I guess, dispel some of those misconceptions, those myths about regenerative medicine? Because it's somewhat relatively new in a lot of people's minds as far as we might have an alternative to traditional surgery or traditional medicine.
Yes, sir. Actually, it's been studied for years, but it's just recently the FDA had come out in the last 5 years or so, say that they see it as a positive alternative to surgery, and it might be a good indicator for people to do for chronic joint pain instead of doing surgery. And so there's different types of regenerative medicine, and that's what people need to understand, is that not all regenerative medicine is the same. There are lower levels where you're just involving growth factors and cytokines, which are more of an anti-inflammatory type chemical in the body and things like that, to the fact where you have, regenerative, where you're using mesenchymal stem cells, and these are tissues that can actually become other types of tissues and repair. We see things from as simple as tendonitis and torn muscles to seeing, the partially torn ligaments and tendons repair, and
Right.
And being able to repair things like meniscus tissue and stuff like of that nature.
It doesn't necessarily sound like it's an alternative to, the worst case being like surgery or whatever the case may be, but it sounds like it's definitely something that is in that interim process of making sure that
A different path.
Yeah, an alternative to a certain point.
Right.
Am I off in that assumption?
Yeah,
Like
that's
something for the animal.
that's absolutely right. That's absolutely right. It's an alternative, but it is an alternative to surgery. There's a point where a patient crosses; they have too much degeneration in the joint, lots of bone spurring, arthritis. If you have too much bone spurring, then something like regenerative medicine is not going to be a good option for you. If you have a complete tear of an ACL, this is not an option. Okay, you're going to have to take surgery to go in there and repair that. But if a patient has chronic pain in the joint, the meniscus has been worn down, they have fraying or tearing of the meniscus, they have partially torn ligaments or tendons or lots of things like that. Most patients are able to do this in place of a knee replacement or shoulder replacement or hip replacement. It just depends. If you wait too long, then you're not going to be able to. But what this is most ideal for people that have been suffering with chronic pain for a long time. It's beginning to affect their quality of life, and they're starting to have to stop doing the things that they love to do. And this is just a very simple, there's no downtime with this procedure. You don't have to take any dangerous drugs. You don't have any of the risks associated with surgery. And so it really is an alternative option for patients. And worst case scenario is you don't get a magical or miraculous result with the procedure. You can still go have surgery. But if you go have surgery and you have a bad outcome, you can't go backwards. You can't undo that.
Right.
And that's where, and so as you go progression, typically when we're talking to patients, we're talking about progressions of what's the next best option that's the safest and most likely to succeed. So that's what we want to do. And obviously I would tell every patient just about, this is something you want to consider before you do surgery, because this might work. You might never have to go through surgery. And we see that all the time with our patients. But if you go to surgery, and about half the patients that go to surgery and have a knee replacement or hip replacement, they do fabulous. They'll tell you it's the best thing they've done. They wish they'd have done it sooner. But the other half of those patients have a complication. They have an infection. They have a blood clot, or something happens, and they'll tell you that they hurt just like they did before, or they hurt worse, or they didn't rehab fully. And so, this is a great option before you consider surgery. And then there's patients that can't have surgery because of other health problems, and this is an ideal situation for them.
What does alternative medicine usually look like? Obviously, it depends on the person, depends on the industry and the injury that the individual has. But is it stretching? Is it using new types of therapy? You touched on a little bit, but what does alternative therapy usually look like for individuals going through it? Or alternative medicine, regenerative medicine.
Okay, so regenerative medicine, alternative medicine are two different things. So that's why I was kind of seeing where you're going with that. Regenerative medicine is as simple as introducing biological tissue into the joint, a natural tissue into the joint that begins to grow and repair in the joint. It's a simplified version of a tissue graft, except instead of having to do surgery to graft the tissue, we actually are injecting cells into the tissue to begin to grow and rebuild what's in the joint.
So
it almost sounds like there's very little to lose. Basically, like what you said earlier, you could do this and then still have the surgery, but you can't really do the surgery and then go this way.
Yeah, absolutely. You can't do the surgery and go this way. Because I have patients that come in. I see a lot of chronic issues, and so I see a lot of the patients that didn't have successful surgeries, and they're coming in trying to find something they can do to help with the pain because the surgery didn't work. Yep. And so we can't use this procedure on those patients because it's not designed to grow. The cells are not designed to grow on metal. Okay, you have a different process going on there, and so absolutely, this is a great thing to be able to do beforehand. But once you've done the surgery, if the surgery does not work and is not successful, then absolutely, unfortunately, this is not an option for that anymore.
So basically, this is the type of regenerative medicine. Everybody should give this some consideration up to a point. I mean, it's open to everybody.
I would absolutely think that everybody should consider it if they're having chronic joint issues and it's starting to affect the quality of life. Absolutely, because it's like I said, there's no downtime. It's very simple procedure. It can massively. We see for our patients, we have just the turnaround in people's quality of life, what they can do, what they're getting back. Whether it's being able to go out and take a walk with their spouse now, or whether it's to get down on the floor and play with their grandkids, or whether it's to go back out and start playing some tennis again because they had to give that up. It's different for everybody, but it's, when you look at the studies head to head compared to surgery, so there's times that surgery is absolutely necessary. I'm not saying that at all. There's time you need a joint replacement, but head-to-head surgery is about 50% successful at getting at least 65% improvement. It takes the example of the California Berkeley study, and then you have an 85 to 90% success rate in the same study with regenerative medicine, and you don't have any complications with regenerative medicine. And about 20% of the people that have surgery have some form of complication. So you're looking at a much safer alternative with possibly just as successful an outcome. So I think definitely it's something that everybody should consider. Now, is it right for everybody? No. There's some people that would need to go ahead, would be better off getting the surgery, and we refer those over if that happens. But absolutely, I think it's the first place to start. If you're having chronic joint pain and you're ready to get your life back, this is where you should begin.
I agree there. I mean, honestly, personally,
yeah, as a man that suffers joint pain yourself,
I too would very much like to be under any form of knife just to get things situated with my joints and ligaments.
And you've been under one before.
Yeah, and I'm in my mid to late 20s. I mean, football, that was a whole nother type of situation. But to that point, though, it's very much, I cannot agree with both you guys' points. It's very much something that needs to be talked about more. Just the alternative, the safety of it all. And especially you mentioned it, the chances of things being good as new, if not better than the actual surgery itself. It's something to at the very least talk more about
and to explore.
Absolutely, something to explore.
If someone's interested in starting the process to learn more about regenerative medicine, alternatives to traditional surgeries and things like that, where can they go? What kind of resources are out there for individuals like that?
Well, I would definitely encourage them to try and go to our website. We have a tremendous amount of research on the website, as well as a lot of patients that have been through the process. It's just AmarilloRegenerativeMedicine.com. That's a great place to start. Now, we're actually doing an educational seminar this coming Tuesday, the 15th. And if they just want to reach out to our office, it's 806-410-6584. If they'll call that number, we can get them registered for the seminar. We do educational seminars because this is such a new treatment and therapy that a lot of people just really want to understand it more. The funny thing is, most people I talk to, once they understand it, they're like, "Oh yeah, that's what I want to do." So they want to understand it first. And so those seminars, we give options for patients to really find out what the options are and how it can work for them. And so, like I said, we do those pretty frequently. But the next one coming up is this coming Tuesday.
Awesome. Well, thank you so much for joining us, Dr. Parker. We're going to step aside. This has been a great episode of the chat here on Newsday Amarillo, the News Channel 10-2.
Have a good weekend. We'll see you later.
Thank you, guys. Bless you all.